Hi everybody, we are going to be filming a kangaroo care or skin to skin video with our interdisciplinary team to talk about important safety measures, comfort of baby, and kind of how the process should ideally look. So you'll hear kind of different staff members peppering you guys with some education points. Thank you all to our very famous actors.
All right, Mom, so we're going to be getting ready to do skin to skin with your baby. The importance of skin to skin is to just, help with regulate her body temperature, help, you guys bond, and help lower any of the stress levels that she's been having since she's been in the NICU. Okay. All right, so we're just going to lift up.
It is great to combine skin to skin holding after a set of cares, so involving the family early and often in hands-on care. So we have just finished our full set of hands-on care, and Elena is getting Mama Trinity ready to hold her baby. Her baby is intubated and has an umbilical line.
Everyone ready for me to pop the top?
Okay. Yep.
All right, I'm going to lift the top now.
When the top is being lifted, make sure there's not an OG tube still secured, and make sure all equipment is kind of out of the field of the top popping.
Okay. Down.
So at this point, the RT is checking for tube securement to make sure the tube is in the correct spot, doing a little pre-huddle with the team, make sure suction is being done orally and inline, and that everything is secured. So oral suction. It is important to remember that when doing an inline suction, the RT and/or nurse is verifying suction depth when lining up the number on the catheter to the number on the ET tube. Do not always just trust the number on a endotracheal tube sheet at the head of the bed, or else trauma may occur to the airway.
And during this time, make sure that you have the help that you need. So if a second RN is needed to help watch your lines, awesome, grab that person. And then a second RT will be needed to help manage the equipment while making sure the tube is secure.
And if you need to put your IV pumps on an IV pole to better access mom getting to baby or the person holding getting to baby and being close to the ventilator, you can do that.
Remember that all of your supplies such as your mask, bag, neopuff, or extra tube suction, and also of course your suction itself is ready to go to be closer to mom and baby.
Alright, Mom, so since your baby does have these umbilical lines over here, we're going to have you do side line. That way we can make sure the lines are secure and that we're making sure nothing's pulling or being tugged out of her. So I'm going to go with you to go grab a shirt and have you go change, and then we'll come back and get baby out. Okay.
Okay, mom is prepared in a gown with the slit facing forward. If your baby doesn't have lines and mom or dad's shirt is really pullable and stretchy, feel free to tuck your baby in. Or if they have like an upper extremity pick line that you can easily visualize outside of the shirt, then feel free to tuck baby on in. At this time, try to declutter your bed. So getting out gel pillows, extra developmental devices, pulling your blood pressure cuff out of the way because that sometimes hits the ground. Making sure that you have all that you need, so available extra blankets, a hat, they might be in your drawer, or you can ask someone to go get you those things prior to kind of repositioning baby. The other thing that you need to be aware of is making sure that you have grabbed an additional suction extension tubing. So what I'm talking about here is gathering one of these and adding it to your already existing suction tubing so that you increase the length so that it can increase the reachability to baby.
And then you need to make sure that once that does happen, that your oral suction is docked so that when you go to suction baby in line when they're holding, that is occluded and able to function.
Excuse me, let me get the skin probe temp.
Yep, so Elena's taking the skin probe temp off, which then will make your bed alarm at times. So sometimes you might have to hit silence. I always alert families that you might hear some beeping. We'll keep an eye on the baby's heart rate and respiratory rate and SATs during this whole process. Then the head of the bed will need to be leveled.
Alright, I'm gonna
Okay.
level the bed.
Tube secured.
1, 2, 3. Alright, Mom, I'm just gonna rotate baby, and then after I'm done rotating her, we're gonna have you bend down, pick her up, stand up, and then we'll walk you back to the chair, okay?
It's best to rotate the baby in a 90-degree fashion so that it's easier for whoever's picking up the baby to be the most secure and not have to have the baby have a lot of air time. So the goal is to minimize air travel time for safety of the patient as well as thermoregulation, so they're not getting that cool breeze of air as they travel through space and time. So prior to doing that 90-degree rotation, please make sure that you have enough slack on all your cords that are connected and any lines that are connected.
All right, ready to rotate?
Yeah, so on the count of 3. 1, 2, 3. Beautiful.
And at this time, it's great for the nurse to coach whoever's picking up baby how to do that. So to place a hand under the neck and shoulders to support that area and a hand under the buttocks area, hips.
So Mom, what you're gonna do is you're just gonna place your hand right under her neck and then right under her butt, and you'll bend while still holding her secure, and then just lift up with her, okay?
And we are doing a modified kangaroo or skin-to-skin care so that we can visualize our umbilical lines. So we have also checked that this is secure, not on this baby because tape is not sticking, but in real life, it's really secure. And that we have another RN over by the IV pumps to help kind of manage any tension that might occur. So in order to do that, the baby will have to be turned slightly so that it's kind of like a side lying skin to skin.
All right.
Okay, so prior to Mom picking up, we've made sure everything is secure and in the right place. Baby has been repositioned appropriately. We have the right help, and our lovely chair is in the proper position so that we can reach with all of our tubes and cables, and it is locked for Mom and baby's safety.
Mom, whenever you're ready.
You have circuit? Yes. Okay. I have 2. And Mom, when you're ready, on the count of 3, okay?
Okay.
1, 2, 3. Good job.
And then just rotate, and then we're just gonna walk back, Mom.
And then as soon as Mom's back of her legs hit the chair, stop and pause for a second.
Keep going, stop.
All right, and then slowly sit down.
Pause, and get attention somewhere. Okay.
Perfect. So in real time, we're pausing and calling out what we see.
All right, we're good to go? All right.
And then scooch your bottom back to the back of the chair. And then, yep.
Move the pole.
Oh, it's
moving.
That's why.
Looks like there's some tension on the line, so she is addressing that.
Okay. Just her leads acting up. Alright, ready? There you go. Are you all the way back, Mom? Mm-hmm. Okay.
Okay, as you can see, the baby is still lateral, so we have visualization on our umbilical lines, and we've also got some tension on our line figured out. Since we are doing this in the rooming in room, this bed obviously will not be in the middle of whatever pod that you are doing this with family. So now Mom has her back to the back of the chair, and we're gonna reassess as baby has an event. Everyone pauses, make sure that we're safe to continue. And then the best thing to do is offer pillows for each elbow because the sides of the chairs are really hard. Sometimes parents like them doubled up, sometimes single. And it's best to do that before you secure anything so that once you start securing, no one's really going anywhere. Then make sure that you have covered baby with a blanket. I like to make sure that whoever's holding still has their skin to skin with their hand, so blanketing over the parent's hand instead of between hand and baby. It gives them that extra piece of bonding. And then if baby's super small, you might consider adding a hat at this time. I recommend doing it once baby is on chest because lo and behold, you put it on in the bed and during transfer it falls off. So just make sure that you're doing it safely once baby and mom are comfy in the chair. And then asking if mom or dad, whoever's holding, wants their legs extended or a footstool, and making sure you have enough room to do that. So you can offer them proper positioning. Okay, RT is busy securing the ET tubing. The RN has already either tucked tubing in next to the parent holding or taped it securely, making sure it's not taped to a pillow or a blanket that can easily shift.
Okay, so we have to have 2 points of connection, one at the top of the circuit to keep leverage off the tube, and the one at the bottom of the circuit to not have slack pulling onto the tube. So I have to have 2 points of connection, and then from there, to secure your connections to either a spot that cannot be, of course, moved or mobile, you can either use clamps to clamp it to a chair, or you can use tape to tape it down across the chair. If you use tape, preferably use more than one piece of tape, and that way you know it's secure for sure going forward. So as you can see from here, we have 1 and 2 points of connection throughout the process of mom holding. From here, of course, the RN and the RT will alternate reassessing the baby, whether it's suctioning needs, needs for tube securement, or needing to put baby back in bed if mom needs to get out for some reason.
The ideal schedule is for everyone to take a 15-minute block. So I'm going to check on Mom Trinity and baby now at 10 o'clock. And then Vinny will check at 10:15. And then I will check at 10:30. And so that each individual is only having to check every half hour. It's also vital that everyone is educating whoever's holding what to look out for. So sounds to listen to, feeling wetness or looking for blood, or making sure the tube isn't kinked. All these things go hand in hand with the parent being part of the care team, and they're the ones closest to baby right now. So they're the ones who can see something before anything worse happens.
Once mom is done holding, the process to get baby back into bed safely is what we just did, but in reverse. It's a very simple process. Throughout this entirety of it, you should have 2 RTs, preferably, and of course 2 nurses. One for lines, tube holding, and then of course vent be pushed back to its origin.
Great opportunity for the nurse or RT to ask if the family member holding wants a photo. Great bonding experience, great for the baby book. The other thing that we can offer, since it's often difficult for whoever's holding to see the baby's face, is to offer a little handheld mirror. So we have those at the shift manager or charge nurse desk in one of the cabinets, and that lets the mom or dad or whoever's holding be able to see baby's face a little better.
So it's important to have your flow inflating bag and your mask like kind of ready to go at bedside whenever you can. So you can either have it kind of hanging off the bed with the mask in the bed right here ready to go in case of emergency.
The other thing about the bed is not to leave it open like this, alarming all day while mom's holding. That's not a very peaceful experience. So making sure that you have left yourself enough room to close up the sides, put the top down, great opportunity to change linens if you've got some soiled linen happening. That way it doesn't interfere so much with the baby. And ensuring lights are dimmed if possible around the parent. The last part of skin to skin is making sure that you document it. So after ensuring a safe and positive experience for both baby and the family member holding, please navigate to your Epic Flowsheet NICU Newborn Care Plan interventions and ensure that you've updated the date of last hold, date of last skin to skin for the day that happened. A good way to see like how often is this happening for your particular patient is you can navigate to date of last skin to skin, right click, and go to Flowsheet history, and it pops up all the dates that baby has been held skin to skin. So you can see, wow, this is a consistent thing that we're doing for this patient, or maybe, wow, we need to really up our game. So a great indicator of how we're doing with getting babies out to hold in a safe and controlled manner.